Hello, ma'am. My
Hello.
name is Sharif Blackwell.
I'm Lashana Eason.
Lashana, my pleasure to meet you.
Nice to meet you as well.
So, I did this movie called Silent Killer,
hmm
and Silent Killer is about prostate cancer. So we're going around Philadelphia to talk to men about prostate cancer, to bring awareness to prostate cancer because it's so real in the black community, and the doctors are not sharing this with us to the extreme that we should know about it. So, what do you know about prostate cancer?
well, again, my name is Lashana. I am a senior surgical services coordinator
Yes.
at the Hospital of the University of Pennsylvania, and I work directly with Trinity Bivalacqua, who is the director of urologic
Okay.
surgery. I apologize. Director of urological surgery. And his role is his specialist is bladder cancer, but he does prostate biopsies, he does bladder biopsies, he does prostatectomies, which is where they remove the bladder, which is where they remove the prostate. And he works directly with many agencies who actually offer treatment which treats prostate cancer after surgery.
Okay. Okay. So, how long you been with him for?
I've been here with him since November the 11th.
Do you like it?
Yeah, I think it's a you do see a lot of, as you state, African American men who come in and they'll proceed with the biopsies, but even after diagnosis, they delay treatment or surgery.
So, in the biopsies, what is a biopsy anyway?
So a prostate biopsy is where you will have a prostate biopsy first if you have an elevated PSA, which is PSA is a blood test which determines the prostate levels in your blood. So if that level is elevated, you should see a general urologist to take that test. If that test is elevated, then you will be referred to a surgeon for a biopsy. The prostate biopsy can be done two ways. It can be done perineal, which is directly through the penis, or it could be done through the rectum, which is through the
Hold on. Paranoia?
perineal.
Perineal. Explain it to me.
A
'Cause you were saying
perineal
it so
biopsy.
fast.
I'm sorry.
I'm like, yo, hold up. Pause for a second. Pause.
Yeah, so there's
Like,
two types of prostate biopsies.
Okay.
So there's actually three types of prostate biopsies. So there's a perineal prostate biopsy where they take an ultrasound probe, which has a ultrasound guide in it, and they stick it in the tip of your penis and take a biopsy of the inside of your prostate.
and you woke when you do that?
No, it's done under monitor anesthesia care, which is not as strong as general anesthesia.
Okay.
But monitor anesthesia care is the same anesthesia they give you in a colonoscopy.
Okay.
So that's one of the ways they do them. Another way they do them is through a probe through the rectum. And the result is the same. The result is the same. They biopsy it so they could get to the prostate through the penis or through the rectum.
Okay. Hold on. So you're telling me they took these probe inside, or are they going through the backside?
They both ways. They could go through both ways. So they could go through the penis or they could go through the rectum.
Wow. Now what's the third way?
It's the fusion biopsy. So if you've had your PSA is high, and now you've had a MRI of your prostate, and the MRI sees that there are lesions in your prostate, doctors recommend you having a fusion biopsy. What the fusion biopsy is a dye which is injected before surgery into through the perineal or through the rectum, your sleep, and it lights up all the cancerous cells which may be in your prostate. So they call that a fusion. So that's a dye. So that's kind of a elevated level of a prostate.
I. So, by you sharing that, I think now men will be really scared to get that done, because I'm like, hold up, that's serious.
It is, but honestly, the biggest complication with all three of those biopsies is light blood in the urine. You don't even remember it happened. There is no pain. There is no scar tissue. Of course, they go over all these possible side effects. But the only real side effect that most people complain about that call my phone is a little blood in their urine.
Okay.
You don't even remember it happening. It's sort of like most people after 40 have had a colonoscopy.
Yes.
It's the same thing.
So why men are afraid to get this done?
It's the idea of it. It's the idea, and people are afraid of. It's sort of like I compare it to the STD test. So you slept with 10 women, and now you're scared, unprotected. Now you're scared to go get a prostate. Now you're scared to go get an STD test. Prostate exams are the same thing. They are afraid of the unknown. Most men assume if the PSA is high, oh, I got prostate cancer. But the PSA can be high for a number of other different reasons than just because your PSA is high, and you may have a very low grade form of microscopic cells of the prostate of the cancer in your prostate. They don't even operate. They just monitor it, because people can have cancerous cells that lay dormant and never, ever, ever do anything.
So why did they say that with the black men, 90% of us will catch prostate cancer?
Because they do nothing about it. They do nothing about it. So there's many things that can be done with prostate cancer. A prostatectomy is actually the last resort.
Are you serious?
Yes.
Why?
Once you are at a grade 3, you have to have a prostatectomy, because grade 3, the next level is metastasis. So that just means you're going to have cancer all over the place, and there's nothing you can do. They do not remove your prostate for type 1 or grade 1 or 2 prostate cancer. They do not remove your prostate. You go on radiation therapy.
I interviewed some men, and they said they had prostate, and they took it right out. They didn't want to go through the radiation. They didn't want to go through the other.
It's a choice. It's a choice, but they do give you many options. So many patients are given the option. We can surveil it. If it's very, very mild, we're going to surveil it. If it's progressing, because what happens is once you have a high PSA, now you have to come see the urologist every 6 months, just to see what that PSA level is doing. So if you come to the urologist and then the PSA is elevated, now we have to have a conversation. Let's go get an MRI of your prostate. Then the MRI comes back and says, well, we do see lesions on your prostate. Now you need a prostate biopsy. Let's biopsy those lesions to see what they are. Most men don't. They stop at the MRI, and then you look at their chart and they haven't seen a urologist in 3 years. And now they're having some sort of complication, and they want to get back and get a prostate biopsy now because something is happening. They're not really honest about what's happening, but usually it affects their usually it affects their ability to have an erection.
Okay.
So they will come in, and my doctor also sees for penile prosthesis and penile implants and all of that stuff. So they're coming in to talk about this, but they haven't addressed the real issue that's causing the issue with the erectile dysfunction.
So how many black men do you see in your office, or men in general?
He only sees. I could count the women on one hand, honestly.
You count the women?
I can count the women.
No, I said how many men do they see? Not saying how many women he sees, but how many men do he sees on a normal basis?
So in a week, I would say he sees approximately about 25 to 30 men in a week.
That's serious.
Mm-hmm.
So what's the age bracket do he see?
Predominantly, they're between 40 and 60. It's as high as 60 and up. They're coming in for something. They're coming in for ED, but 40 to 60 are the prostate cancer people.
Wow. A lot of men don't know how serious this is. When I try to explain to them, they look at me as like, they don't want to hear it. So when other men say it, they don't want to hear it. So we're trying to reach them. And I think having a discussion with you that you're in the office and that you see it firsthand, that men will grab a hold of it and men will understand. But it's like, how can we really push it for them to really understand how serious this is?
I think there's a hard conversation. It's the hard conversation. So the most common, like I said, men get test their PSA at 40 anyway. But the most common, the first sign that sends most men to the urologist specifically and not their PCP is blood in the urine. And that's called hematuria. And blood in the urine is usually microscopic. You can't see it. So when you get to the point you can see it, it's a problem. But that's what sends them to the urologist's office. And once they get there, they want to see them because they want to resolve an issue. But I think they have to want to pursue it themselves. It's hard because a lot of them, the issue is not trying to resolve an issue. So the issue is not seeing a urologist. The issue is, okay, now you've seen him, now he's telling you what you need to do. How do you move forward from here?
But do you think that if it was more education on it with us men, that men will get it done more?
Honestly, you want to know what I believe the biggest problem is? There's no men in urology that look like us. There's no black urologists that look like us. Doctors and surgeons do not go to, when they go to medical school, urology is not at the top of their list. Because the question is always, who wants to be a urologist? As a man, who wants to be a urologist is the big question. And I'll give you a perfect example. So Penn is trying to recruit black urologists. So they recruited a urologist from New York. What's the Memorial Sloan Kettering?
Yes, I'm familiar
Memorial
with that.
Sloan Kettering. So he came and he did the interview. They made him an offer. You want to know why he came to Penn and went through that whole process? Because he wanted Memorial Sloan Kettering to give him more money.
That's that black guy that's in New York that I've been trying to interview.
He went through the whole process. Penn made him an offer. He took Penn's offer to Memorial Sloan Kettering and said, listen, every hospital in the country want a black urologist. Don't give me what I want, and I'm going to Penn.
I thought they got one on Ceylon Avenue.
No, I'm talking about surgical urologists.
Oh, okay.
Urologists can work you up. Urologist jobs is to work you up. So the general urology is going to order your PSA. They're going to order your MRI. They're going to do all of those things, but they cannot do a prostate biopsy. A surgeon has to do it.
Okay. Wow. Okay.
You follow me?
Wow.
So there are no surgical urologists that look like us.
Wow.
And when black men go into an office, yes, I'm coming to see you, and that's fine. But now you're talking surgery, and all I see is this white man in front of me. And I would just be real with you.
Wow.
Or two questions are asked. Do you have any black urologists and women and females? That's the two questions, most common questions that are asked. Do you have any female urologists, or do you have any black ones? And the answer is no to both of them.
While you were saying that, I was Googling on my phone to see if I could find one, so I can say what I couldn't.
Because there are none. I'm telling you. This just happened maybe, and this just happened, I want to say, in December. With this urologist from Memorial Sloan Kettering. This just happened. This is not new.
So so as we was doing the movie, I was trying to interview with Penn doctors on this prostate thing, and they would not allow me to come in and have a conversation with the doctor. They wouldn't. And I was like, wow. But, I don't work there no more, but if I worked there, maybe I could have went through the back door.
Your back door, right?
But the only way us men will really get it is we need y'all help. We can't get it without y'all help. So, you know, they got the blue pill they got, and they try to push this on the men now. It's ridiculous. But there's nothing in that room, in the doctor's office, to talk about prostate cancer. But I think if we had pictures up there that shows information on it, men will ask about it probably more.
Yeah, I agree.
But there's nothing up there. And I've been to the doctor several times, and I've been like, why y'all have that? And they said, we don't. And I'm trying to get an understanding of why the doctors, your own primary care doctor, don't push this on us men.
I think part of it is because PCPs are a very general practitioner. I think it's a matter of specialty. And doctors live by this code of, if it's not my specialty, I don't know, you have to see someone who specializes in that.
Okay.
That's the most common thing that I hear. Like, I'm not a urologist. I don't do that.
Okay.
And I hear surgeons say it all the time. I don't do that. That's not my specialty. Let him do it. So I'm sure if that's something surgeons say, primary care say the same thing. I firmly believe in self-advocation. Being a self-advocate, being your own self-advocate.
Mm-hmm.
I think the first steps start in education. So if people are aware of what to ask for, do you have this? Then do that. If you have hematuria is because a lot of it is ignorance too, because doctors speak in doctor's language. Mm-hmm. And if somebody told me I had hematuria, I'm gonna say,
what is that?
What is that?
I'm about to ask you that.
It's blood in the urine.
Right.
It's visible blood in the urine. Because there's hematuria is only a diagnosis because you can see it.
Right.
You can have blood in your urine before you ever see it. You can have blood in your urine, they put a dipstick in it and it says there's this blood in the urine, but you can't see it with the naked eye.
Oof. I get some of them dipsticks. Because like seriously, like you know, you don't know.
You don't know. I think it starts with. I think even in community. I think it has to start in the community. I don't think it starts at the doctor's office. Like it starts at the barbershop.
Okay.
It starts at the churches. It starts at the schools. It starts in the communities. It starts at community centers.
So I'm going around with this movie, different places, to really push this prostate cancer and to let them know that it's okay to go to the doctors. Mm-hmm. And it's okay that we can sit down and have this conversation. Because when I go to the barbershop, we talk about sex,
drugs and rock and roll.
Drugs.
Music.
Music.
Celebrities.
Sports. Everything you can think of.
Mm-hmm.
But when you talk about this,
it's uncomfortable.
You can hear a pin drop.
It's uncomfortable because no one wants to have the uncomfortable conversations. But I think that's why it has to start at the community, because if the more people have the conversations, the less uncomfortable it becomes. So if prostate biopsies become like, oh, did you get your colonoscopy this year? I mean, people talk about colonoscopies. Where you think they put a probe for a colonoscopy? Mm-hmm. In your rectum.
Right.
It's the same thing. It's the same thing. They just go in a different direction. And people need to be aware that they don't have to go through your rectum. If you're uncomfortable with them going in your behind, they can go in your penis.
Hold on.
Like, because the conversation becomes, they're not going in my butt because I'm not gay.
Hold up. You're telling me instead of going to my behind,
the probe is literally this long. I've seen it. It's a plastic probe this long. The other issue is when men get their first prostate biopsy, sometimes they have to leave with a cath because they can't urinate. The minute they urinate, they come back and have the cath pulled. Oh, I'm not doing that again. It's usually because that's what they'll say. Oh, I'm never doing that again because I had to have a cath. I'm like, well, you had a cath because you couldn't urinate. You couldn't produce any urine. So they was like, but how can they guarantee me that I will be able to produce urine this time? Well, they can't. So that's the flip side of. So if they go get the prostate biopsy and they leave with the cath, then the cath typically comes out the next day because it just took them longer to produce urine for the stuff to get connected back up. So I haven't met anyone it's been in more than 2 days. So they have the nightmare of the cath. Oh, I'm never doing that again. So they don't come back.
Wow. Wow. So,
it's a lot that goes into it, but your life is worth it. Like Penn's slogan is, your life is worth Penn medicine. Your life is worth it.
Wow.
Because no one wants to have the conversation, oh, you have prostate cancer. And they do all of these scans. They do MRIs and they do PET scans. And then you have a PET dope scan, which is essentially like your body literally looks like a piece of glass. Like literally the PET dope is called PET, PET-DOT-PSMA. That's the scan. And that is the highest scan you can get to see if your cancer has metastasized throughout your body. And it literally makes sure your body looks like glass because they can see everything in it. And then you walk out their office and we never see you again. Nobody wants to have that conversation of there is nothing we can do. Nobody wants to ever hear those words. So it's better to do the testing now than to have the conversation. There's nothing we can do.
So what is the glass? So it's a glass scan?
No. So it's a PET scan. You go into a thing, but when you look at it on the screen, it looks like glass, like your body. It don't look like, you can't see any skin. All you see is your organs and your tissues in your body. That's all you see.
So you go in a room.
No. So you go in the room. You take off all your clothes. Of course, they put an IV in your arm. They inject you with dye.
Okay.
The machine, you go completely in the machine. Your body goes completely in this machine. The imaging on the machine, the dye they put in your body, and the imaging on the machine, you don't look like a human being. You literally, everything in you is lit up. Everything. Like everything, your liver, your kidneys, your whole entire body is lit up like a Christmas tree. You can't see your skin.
And then they can diagnose what's wrong with you.
You can see the lesions. You can see them. You can literally see them.
And that's at stage 4, or is that stage?
Once you start seeing metastasis, it's in your brain, it's in all your organs, it's everywhere. It's in all of your lymph nodes. It's nothing they can do. The cancer has taken over your body. If you want to go to chemo, you could have typically at that stage they do chemo, and if I'm honest, it doesn't do anything. It makes you sicker. Because at that point you have brain mets. And you'll be surprised the people who do nothing. And then they get these scans and they're telling me you can take them off the OR schedule. They have brain mets. The amount of people I take off the OR schedule, and it's not just black people, it's white people too. You literally have to take them off the OR schedule because there's nothing they could do for them. Because now the cancer here's the issue with cancer. We're talking about prostate cancer today, so we'll focus on the prostate. If prostate cancer is just in your prostate, they can take it out. If your primary cancer is in your prostate, perfect. Take it out. Take the lesion out. But when cancer is everywhere, or if you at stage 3 and you don't get radiation, you don't get chemo, you don't do anything, it's just going to show up somewhere else. It just shows up somewhere else. And I've been working with a cancer surgeon. I've been with Vivalacqua since November, but I've been working with a cancer surgeon for 10 years. It's better to know than not know, because not knowing is not good either.
I'm stunned for words.
It's
I'm really stunned for words because as I'm trying to push this movie throughout Philadelphia, and I'm trying to hit these doctors' office, trying to get them to talk about this more, try to save somebody's life.
Mm-hmm.
So I need y'all help. Without y'all, we can't do it.
Mm-mm. I agree.
So we really, and from having a conversation with a black woman that works in our office,
Mm-hmm.
that if you don't listen to me, listen to a sister
Mm-hmm.
who's going to help y'all.
Yep.
Because you can look at me and say, man, we ain't trying to hear it.
Right.
But for you are right there
I'm right in the center of it.
in the
Yep.
center, and it's like they need to hear that. And like you said, you're starting at 40 to 60 something. So do you see is men in their 40s or dying from more, or is it the older?
No, so you don't see a lot of them dying at this stage. But what I do, because they disappear. You just
okay. You don't know.
You just don't see them. But what I do see is we see a lot of second opinions. We see a lot of people that comes for second opinions. And I think that's important. I think people need to use that option.
Okay.
If you're not certain that this is something you want to do, or you think that the diagnosis is not real, go talk to somebody else at another health system. But if you go to another health system and the results are still the same, now it's your turn to do something. It's time to do something. If two physicians have told you, two surgeons have told you to do the same thing, then everybody is not against you.
Wow.
I think people should use their option for a second opinion, because one person don't know everything.
Yes.
And on the flip side, what people don't know is, even if you have a complicated diagnosis and the doctor says, I don't know, but I'll have your answer in a week. We have something called tumor board, where there's 6 cases a week that go on tumor board. And they talk to a whole panel of their colleagues and get a decision on this case. So they're not just thinking with their own. They're not just high and mighty and think they know everything. No.
Right.
I see it from behind the scenes. So they're not acting like they know everything. They actually ask their peers and see how they would proceed with something. But if you've talked to a doctor at Penn, or you go to Memorial Sloan Kettering and they both told you the same thing, then you probably need to get it removed or treated or something. And I think the biggest issue for men in prostate is most men don't have to have an MD from anywhere. They know your prostate is directly related to your sexual function. Most men know that. But there are so many options that are available that restores their function. I think that's the other side that people need to know. You will be able to get an erection. There are thousands of things available for it. And I'm not just talking about Viagra. They have injection therapy. They have prostheses that they balloon it up. There are so many options available. that you can pursue and save your life and still enjoy your sexual health.
Wow. Wow. I really thank you
You're
for
welcome.
really sharing, like, some words. It's like, ooh, sharing the light on this. Because we don't get to hear this like this.
Right.
We heard doctors talk, but never really talk.
Right. They talk to you, not
Right.
with you. Not
So-
they talk at you, not to you.
So this is why I'm so tongue-tied, because from what I've been getting from the doctors we don't know why it's so real with the black community. We know we still trying to find out why, or this or that. So they not really pushing it.
Well, they're not. They have no relationship. Most of these doctors are white. I'll just say that. They have no relationships with. They don't have enough relationships with black men. Enough friendship, partnerships, or anything with black men to know why black men don't want to do it. So I understand they're absolutely right. They are absolutely right. But I have talked to enough black men in that office. That's all right. I'm just gonna call you back and think about it. I'm gonna call you back and think about it. And you call them, they don't answer the phone. They don't return your phone calls. You understand what I'm saying? But I'm a black woman. I know why y'all aren't doing it.
Okay.
Because they tell you all the side effects. Oh, your penis gonna leak. You're not gonna be able to get an erection. It's gonna affect your sexual health. And they're listening to. They don't hear nothing about the cancer at this point. This era is closed. All they heard is, "What you mean? I'm gonna have to wear a pad because my penis gonna leak, and I ain't gonna be able to have no erection. I ain't doing that." I could hear it loud as day.
So is there any way that we can, like, have a brunch with some of the doctors at Penn, and they have a discussion with the men? Is there any way that we can set that
I'll
up?
talk to the manager, the business. What's her name? I'll talk to Tara now.
Okay.
Because that has to go through her, because she's their boss.
Because I think that it will be helpful that if we can try to bring that,
I'll talk to Tara and see what she says.
because I think that'll be awesome. I mean, I wish we could have jumped on it sooner, because Father's Day is around the corner. I think if we could have did something like that for Father's Day, have a brunch, and then have doctors show the movie, and have doctors, like, really.
I think prostate awareness is the only day that there's no awareness. There's the only thing that there's no awareness for. There's breast cancer awareness. There's cancer. There's melanoma awareness. There's an awareness for everything else, but there's no awareness for prostate.
That's why we're trying to really push this
I
really
think
heavy.
I firmly believe if it starts in the community, and you get enough people making enough noise, there has to be a way to get it in the community. And the only issue the only concern I see is, if you make people aware of something, then people are going to have to start doing something. And will it be cost effective for somebody like Penn? Will it be something that they can, what's the word I'm looking for? Because as I stated earlier, Penn is about money. So is it something that they could have a financial benefit for, that they could see themselves contributing to, if that makes sense?
Okay.
Is that something? Is it a way that's going to bring you more patients in the door? Like, what benefit? We have to figure out what's the benefit to them.
Well,
That's the only time they're going to do something.
I think if Penn got him more involved, just like when E&I has Men Know Your Numbers, if Penn got more involved, and we had a clinic where men did their PSA, talk to their doctors,
Yep.
and they say, okay, I have it. Where do I go? Do I go to Fox Chase?
Right.
Do I go to Jefferson? Do I go to Penn? Who do I go see?
Right.
So you want to try to build that relationship.
Right.
So
Right.
it has to start somewhere.
You know what? They had a Penn Cares grant. I think it's a Penn Cares grant. And I'm not sure when it comes up, I'll check. But that's a perfect opportunity. That's a perfect opportunity actually to go into the community and to share like what you're doing, to share your movie, for Penn to donate make some prostate kind of prostate biopsy or stuff like brochures and handouts.
So I have brochures, I have handouts,
Okay.
I have stuff, but I really want to shoot this. I really want Penn to see if we can get this around. I know Father's Day is too late, it's too soon. So can we try it, do something around the 4th of July?
Yeah, let me see. I'll talk to Sarah Nate tomorrow.
Because I really want to, because I think if we can really do it, and I think of being indoors, you know, we can have a cookout indoors, that, you know, show the movie, have the doctors come, have conversations, build a relationship, and then go outside, we can fellowship with food, we can
Right.
do certain things like that.
Right.
But it's about, we need y'all.
Yeah, my thing is
get
marketing
involved.
too. So how would you market by July the 4th?
Social media.
Okay.
You can, social media do everything.
Yeah, that's true.
I got a shoe. I got these shoes. I'm gonna sell. Where are you going? Throw it on social media.
Okay.
You got Instagram. You got Facebook.
That's true.
You got this and that.
That's
so
true.
I think that can market it, and I
Okay.
think if we market it well enough, that I think it'll
It turned
be
out to be good.
it'll be really nice.
Sorry.
I'm sorry I put you to sleep.
No, you're not putting me to sleep. I'm
So I
tired.
think that would be something worth doing,
Yeah.
and I think that flyers, radio. So I think it can be done. It really can be done. But I think we need, as in the black community, we need the doctors to get more involved with us.
Right. Right. I
We need to
agree
get
with
more involved with us because the older ones, we are dying, and then the young folks are dying from gun violence.
that. True.
So you're dying from prostate, and you're dying from gun violence, the young ones.
Yeah.
So we both of us are dying. And now we leaving y'all, the women and our children, here by yourselves.
Yep, that's true. True. So true.
So I just think that's the most important part.
That's true.
And I thank you
Thank you so much.
for everything.
you.
And like I said, I would love for us to stay in contact.
Yeah, definitely.
To really stay in contact, to really make this, because with my nonprofit organization, I'm really trying to push this out there.
Okay.
You know, our nonprofit is supporting kids internationally with love and lessons. In order for me to teach my children, with supporting them with love and lessons, this here is the love and the lessons that we getting.
Start there. That's true.
It starts here.
Yep, that's true.
So then we can share, because at the end of the day, they are future.
They are.
So maybe if they see us doing this,
They'll follow in our
they're
footsteps.
following our footsteps.
Yep. I agree.
So this is why I'm really doing this.
Okay.
And I really thank you. And I really thank you
You're very
for
welcome.
taking your time out to really, and like I said again, I'm available 24/7
Okay.
to have this conversation.
Okay.
And if the doctors wants me to come in and have a talk with them face to face with my team, I have no problem with doing that.
Will do.
And I think that'll be something that we can talk about. And like I say, if we can, and I even can speak to Enon. So if they want to come there to have it, or we can have it in a park, or it's places
Right.
throughout
right,
Philadelphia
Right.
that it can be done.
Absolutely.
So we just need y'all help to get it out there the way it needs to be.
Okay.
And I think that will be a big awareness,
Yeah.
because like you said, there's none. And so with my design that I'm creating now is me trying to push this on YouTube, Instagram, Facebook. We trying to get posters up in the doctor's office now. We trying to get it on the SEPTA buses, on the subways. I'm trying to put it out there. but I can't do it by myself.
That's right. That's right. I agree.
So I really appreciate you coming out to sit down with me and to have this conversation. I really do. I really do.
Thank you for having me.
Anything else you want to share before we end this?
No, that'll be it. Thank you.
Thank you so much.